everyone, welcome to my channel Physiotherapy. So today we are diving deep into a crucial surgical procedure, thoracotomy. Whether you are a student, a medical professional or just curious, this video will break down thoracotomy in a way that is both comprehensive and easy to understand. Let's get started. So the topics I'll be covering are introduction, procedure, incision, purpose, contraindication, investigation, pre-op physiotherapy, post-op physiotherapy, rehabilitation, complications, statistics, and bibliography. So, what is exactly thoracotomy? The basic meaning of thoracotomy is thoracic surgery that is performed to access or operate lung, bronchi, esophagus, and in some cases heart. When talking about lungs, it is done to treat cancer or remove whole or a part of a lung. For heart, it can be a stenectomy, mini thoracotomy, and for examining tissue sample, biopsy is performed. And in emergency cases, when there is bleeding in the heart or the presence of cardiac tamponade. Now, what are the procedure of the surgery? So, first is positioning the patient. We will start by positioning the patient according to the incision to be performed. Then general anesthesia is given prior to the surgery. Now lung is deflated through special tubes so that the surgery can be done. The breathing tube or the ventilator keeps the lungs working. Now when the surgery is done, the lung is re-inflated again. Chest tubes for draining the fluid, air, blood are placed. Now the final thing is closing the surgery site and cleaning it. Now coming to the incision. So first the incision we will talk about is posterolateral or the standard thoracotomy. It involves an incision below the scapula with division of latissimus dorsi and serratus anterior muscle that transects the rhomboids and trapezius. Next is anterolateral incision, used in variety of operations, runs from lateral border of sternum to mid-axillary at 4th or 5th intercostal space, dividing pectoralis major and serratus anterior transverse incision. This incision is not common as it cuts the fascia. It starts from the fourth intercostal space to other side dividing sternum and pectoralis major muscle. Next is vertical median thoracotomy. It divides the sternum vertically and cuts the parasternal aponeurosis of pectoralis muscle. Now what are the indications of the surgery? In case of tumors or any metastasis, growth can be removed through incision. In case of any fibrous lung lobes with lobar pneumonia are removed, sleeve resection can be performed to remove any blocked airway with or without the lung segment, like in case with severe bronchitis or TB with severe infections, in order to correct any congenital anomalies. In case of emergency like gunshot, RTA, sharp stab injury, this surgery is performed. Now, what are the contraindications? So, the surgery won't be performed in patients who have poor pulmonary function, poor vital capacity, critically ill patient who are not fit for anesthesia, patient on full grown AIDS, renal disease, hepatitis. Now, what are the pre-op investigations? So, checking for rib fracture or pleural effusions through X-rays, checking for bleeding or infection through CT scans. ECG will be performed with all required heart informations. Blood tests will look for anemia, infection, leukemia, urine, liver, kidney, blood sugar. These tests are also performed. Now let's talk about taking the assessment, which is divided as subjective and objective. Subjective consists of name, age, gender, date, IPD number, occupation, address, and taking past personal, family, socio-economic, and other surgical history. In objective, we will check for exercise tolerance testing. Now this is an ECG recorded when the person is exercising. The test usually takes around 15 minutes and usually done on treadmill or static cycle. Now this test tells the working of a heart in active state as it requires more oxygen and blood. Now checking for the level of consciousness. Then checking for posture, mainly kyphosis and scoliosis also develops within time. For checking of any levels of distress, that can be cardiac or pulmonary. We can go for pallor, that is clubbing. It can be due to low oxygen in the blood, sign of various lung disease like carcinoma of bronchus, bronchitis. So now what happens in clubbing is the tip of the finger near the nail region gets enlarged or swollen resembling a club. Now what is pedal edema? So it is a swelling present on the foot, ankle or leg. Can be caused due to venous insufficiency, severe lung disease and heart conditions. Now we can talk about cyanosis is developed suddenly or with shortness of breath and is usually due to lack of oxygen in the blood. So sinus is considerably of two types. One is center and then other is peripheral. So center improves with oxygen therapy, whereas peripheral improves with warming the area, like mostly seen in cold areas. We will check for stridor, that is heard during inspiration through obstructive upper airway. Then we can check for the wheeze, that is musical sound heard during expiration. We can go for abdominal paradox. Now what is it? It is a physical sign of diaphragmatic dysfunction where diaphragm moves opposite to the normal movement. We will go and check for the cough. So is it dry, frothy, or is having any foul smell, or it's wet? Now let's go for the sputum. So normally 100 ml is produced daily and it gets cleared subconsciously also. So sputum colors will indicate any undergoing lung conditioning when normally it is colorless or egg white. Now coming to the goals of the treatment, which are to gain patient's confidence, obviously to gain good breathing control, increase vital capacity, clear lung field, teach postural awareness, teach arm, trunk and leg movement, teach mobility about bed, to teach lung expansion exercises. Let's begin with preoperative physiotherapy. Now general breathing exercise is taught where the main focus is on inspiratory exercise with hold. So the instruction to the patient will be as take deep breath, hold it, breathe a little more, expire. As we can see in the image about the percussion and vibration, with postural drainage aims at losing the secretion from the airway walls and accelerates clearance from peripheral lung regions. Next, because of the incision and pain around the region, the patient tends to rise the hip and lower the shoulder. Now to prevent this, the patient is taught a good posture and how it really looks like. It gets necessary to explain the reduced muscular effort, hence minimizing fatigue. Now bilateral strengthening can be started like trunk rotations, side flexions with weights or resistance, plank and bridging. Agility exercises. Some activities like they are made to perform only when the patient is fit enough. This also improves secretion. General ROM with main focus of shoulder of the operated side as latissimus will get cut. Hence, active assisted elevation through flexion is introduced. As seen in the image, the patient assists with the non-operated arm and performs flexion in both positions. To make the patient independent and gain general mobility around the bed is introduced. Now teaching the technique to support the incision during the cuffing, huffing or movement is explained. In image, one of the patients supports by himself. In second, the physiotherapist supports from the same side. And in third, the bear hug support is used. Patient is taught how to use pillow and support the incision. Now checking for the post-operative list. So here comes the type of operation or incision performed. The chest radiograph will look for changes following surgery. Temperature is measured as fever after surgery is a common complication. We will check for the pulse rate, checking for blood pressure, looking for drug chart and fluid chart. Now we can check for oxygen therapy and we can check for the drains, how they are placed, they are in place, they are cleaned. Now post-op goals. So what will be our post-op operation goals? It will be to improve and maintain full expansion of the lung field, to clear secretion from the remaining lung, to prevent joint stiffness, to prevent circulatory complications in first 2-3 post-op days, to maintain good posture and to prevent any wound complications. So post-op day, we are talking about day 0 here. Okay, so milking of drainage tube is important so as to retrain air and fluid from the pleural cavity, and the method is, let's see in the video.
Step 3. Look for clots or blockages that may prevent the fluid from flowing out of the tube and into the bulb. Some clots may be hidden inside the tube under your skin. Step 4. Loosen the clots by gently squeezing the tube surrounding them. Step 5. Use one hand to hold the drain tube in place where it leaves your skin. Step 6. Use your other hand to pinch the tube with an alcohol wipe between your finger and thumb. Step 7. Slide your pinched fingers along the tube to force any fluid out of the tube and into the bulb. You may need to repeat steps 5 through 7 several times to clear the tube. Try not to let go of the tube between steps. If fluid remains in the tube or you accidentally let go, repeat steps 5 through 7 using a new alcohol wipe. Do not allow the bulb to become more than half full. Look for clots or blockages.
So now after milking of the drainage tube, what we do is we ask the patient to do general breathing and now support the incision if required. That can be done by general hand placement or help of pillow over incision. Take deep breath till 1, 2, 3, 4. Now expire slowly. Ask patient to breathe in through nose and out through mouth. Now active limb movements are initiated so as to prevent circulatory complications, which involves ankle plantar flexion, ankle dorsiflexion, ankle circles and heel slides. Position of the patient. So according to the bad lung rule, we are going to follow it as it promotes gaseous exchange because ventilation and perfusion are greater in lower regions. Let's start with day 1 post-op PT. When patient still in bed, ask him to perform segmental expansion. Ankle foot exercises to be performed regularly, asking patient to check for posture as guided earlier. Mirror can be used for biofeedback. Huffing and coughing started with proper splint and support. For prevention of post-op lung collapse, ask the patient to move frequently and keep changing the position. Short frequent sessions are to be planned so as to decrease the fatigue of the patient. Now, the first duty of a physiotherapist should be try to make the patient sit out of bed. By room, arm exercises are carried in these positions. The incision side of the arm is made in full elevation. Ask patient to keep hand behind the head and touch opposite shoulder, as we can see in the image. Next, on day 2, all required exercises of first day will be done with trunk exercises with range and position comfortable patient. By end of the session, walking is encouraged with proper posture and arm swing. As we can see in the images, all these exercises are to be carried. Day 3 with introduction to the group therapy and shoulder ROM is started, which includes pendulum, wand exercises, pulley, active ROM of the shoulder. By day 4, patient according to the comfort will be able to dress himself. Walking should be increased, stare up and down with care of breathing is done. By day 5 to discharge, that is 7 to 10 days, the stitches will get removed. Scar mobilization is done by massaging as seen in the figure. So these are the three type of technique we can use so as to mobilize the scar, as it increases the range, strength and mobility. So now talking about the long-term managements, regular checkup in presence of therapist, patient advised to avoid overexertion, prolonged standing to be avoided initially. Therapist must see improvement in exercise tolerance, chest expansion and upper limb mobility. Patient is instructed to continue breathing exercises with thoracic mobility till 2 years following surgery. Patient restricted to lift anything weighing greater than 10 pounds for 6 to 12 weeks. Now what is ventilatory muscle training? So the first come is spirometry. Here, the patient in comfortable positions take few deep breath. Now place the spirometer in the mouth and inhale. Now hold and exhale. As we can see in the presented video, this increases volume of the inspired air and prevent alveolar collapse. Next we go for deep breathing exercises. So this increases and lengthens the diameter of the airway and helps to loosen bronchial secretions. Deep breathing should be encouraged to prevent unnecessary collapse. Now, what is glossopharyngeal breathing? So, in simple word, a patient is asked to say gup with minimal vocal sound. As we can see in the video,
Tongue lips close, trapping air in the pharyngeal space. The tongue moves upwards to the soft palate, forcing the bolus of air.
Next, what we see is pursed lip breathing. So, breathe slowly, deeply through the nose. Now, purse lip as to whistle. Breathe out through lips. This helps with ventilation, releases trapped air. Because of this, the positive pressure is generated, which keeps bronchioles open and prevent from collapse. Next, we go for lateral coastal breathing. So, as seen in figure, it is performed in supine or sitting and with help of physiotherapist or self. Place hand on the lateral aspect, ask the patient to expire. Now apply a downward pressure just before inspiration. Apply quick down in stretch. Now this is a very basic exercise routine where the first some weight is provided to patient and asked to perform shoulder and elbow flexion. In second, the patient performs retraction and protraction, that is for scapular stability. Now we can go for wall push-ups. Next, chair supported squatting, another good way. Knee flexion and extension, step up and down, shoulder abduction with weights, sit to stand with arm swings, general walking. So these are some basic exercise routines. Now rehabilitation. So usually occurs in phases. Phase 1 is with pain and swelling. Phase 2 begins ROM and cardiovascular training. Phase 3 restores ROM, improves strength, endurance, and proprioception. Phase 5 comprises of strength, sport specific training. Introduction to rowing machine, as it is very effective aerobic exercises, good for both upper and lower body, with providing low impact cardio for beginning and increasing endurance. Cycling initially can be done as a static and progressed with dynamic, as it increases cardiovascular fitness, improves joint mobility, increases muscle strength. Treadmill, starting with walking, then we can go for incline walking, jogging, then we can go for side shuffles, back pedal, up and down, and Tabata workout. Swimming or hydrotherapy, as it improves exercise tolerance, walking, jogging underwater, jumping jacks in the water, leg kicks, water arm lifts, lateral arm lifts. These are all forms of exercises we can do in the swimming pool. So if one doesn't know how to swim, they can do all these kind of exercises in the water. Then upper arm ergometry is a high intensity workout which improves cardiovascular endurance and muscle strength. Aerobics, Zumba. American Heart Association recommends aerobics to people with heart and lung disease, as it improves cardiovascular fitness. Now, what are the complications? So post-op we can see scoliosis, prolonged need for ventilatory support, infection, bleeding, blood clots, DVT or pulmonary emboli, bronchopleural fistula, post-thoracotomy pain syndrome. So now we can go for the management of the scoliosis. So bracing can be done. Scroth method, that is goal is to derotate, elongate, stabilize the spine in a sagittal plane by restoring muscle symmetry and alignment. Now these kind of clap exercises are also good for stretching and strengthening back muscles. Breathing exercises, as the curvature causes pressure on airway, hence the patient experiences difficulty in breathing. Management can be DVT, so we can manage DVT by compression stockings or early mobilization, chest PT, and other endurance training. BP fistula, so drainage of air and fluid as patient being sidelined to prevent spillover fluid to other lung. Now what does the statistics say? So out of 323 patients took this survey pre-operative. So when we see about supported cuffing, 92.3% patients showed better improvements than sustained maximal inspiration and active cycle of breathing technique. So these are the percentages and the exercises what pre-operative showed better results. Okay. So these are the bibliography. So mostly all the notes were from Cash Cardio, Physiotherapy in Surgical Conditions, and Cardiovascular and Pulmonary Physical Therapy by Watch. Thank you. So to sum up, thoracotomy is a vital procedure that plays a crucial role in treating lung disease and trauma cases. With proper pre-op and post-op care, patient can recover successfully and regain full function. So thank you for watching this detailed overview of thoracotomy. If you find this video informative, don't forget to like, comment, subscribe for more medical content. And if you have any questions, feel free to leave a comment below. Stay tuned and take care.